Did you know that over 35 million people worldwide suffer from substance use disorders? Addiction is not just a personal battle, it's a global crisis that profoundly affects families, communities, and societies. Today we delve into 8 dark secrets of living with addiction that many people may not understand. Each of these aspects shines a light on the complexities of addiction and the struggles faced by those affected. Many individuals ensnared in addiction convince themselves they can control their substance use. This belief often stems from early experiences with drugs or alcohol, where they felt they could stop at any time. However, the reality is that addiction alters brain chemistry, particularly in the areas responsible for decision-making, impulse control, and reward. As dopamine levels spike with substance use, the brain begins to prioritize the drug over basic survival needs. This creates a dangerous illusion. The more one uses, the more control slips away. Understanding this can help individuals recognize the need for professional help rather than relying solely on willpower, which often leads to disappointment and guilt. Addiction breeds isolation. Those struggling often withdraw from friends, family, and social activities. This self-imposed isolation can stem from shame, fear of judgment, or even the need to hide their substance use. Ironically, while they may crave human connection, the addiction creates a barrier that feels insurmountable. Research shows that social support is crucial for recovery, yet the very addiction that drives them away from loved ones also leaves them yearning for connection. This loneliness can lead to deeper depression and anxiety, creating a feedback loop that perpetuates the addiction. Building a support network is vital, yet daunting for many. The financial implications of addiction are staggering. The cost of maintaining a substance use disorder can lead to significant financial strain. For example, the average cost of a daily heroin habit can exceed $100, while prescription opioids can cost even more when used inappropriately. Many individuals may resort to borrowing money or engaging in illegal activities to support their addiction, leading to criminal charges and further financial hardship. The fallout can include loss of employment, damaged credit, and even homelessness. This financial ruin creates a cycle of stress and desperation, making it even more challenging to seek help. Understanding the financial toll can motivate individuals to seek help before their situation becomes dire. The physical consequences of addiction are often underestimated. Chronic substance use can lead to severe health issues, including liver damage from alcohol, lung disease from smoking, and cardiovascular problems from stimulants. Additionally, those who inject drugs face a high risk of infectious diseases such as HIV and hepatitis C. Beyond these immediate health risks, long-term substance abuse can lead to irreversible damage, requiring extensive medical intervention and recovery time. The body begins to deteriorate, and recovery can take years, if not decades, to achieve. Understanding these physical risks is crucial for individuals and their families, highlighting the urgency of seeking treatment before it's too late. It's not uncommon for addiction to co-occur with mental health disorders such as depression, anxiety, or post-traumatic stress disorder, also known as PTSD. This dual diagnosis complicates treatment, as both issues must be addressed simultaneously for effective recovery. For many, substance use is a way to self-medicate undiagnosed or untreated mental health issues. Unfortunately, many treatment programs focus solely on addiction, leaving underlying psychological issues unresolved, which can lead to relapse. Understanding the connection between addiction and mental health is critical for creating comprehensive treatment plans that address the whole person, not just the addiction. The societal stigma surrounding addiction can be crippling. Many individuals feel ashamed of their addiction, fearing judgment from others. This stigma can prevent them from seeking help, perpetuating the cycle of addiction. It's important to recognize that addiction is a disease, not a moral failing. Stigmatization can lead to feelings of worthlessness and hopelessness, making it even harder for individuals to reach out for support. Advocacy for addiction as a health issue, rather than a character flaw, is essential in creating a more supportive environment that encourages individuals to seek the help they need. One of the harsh realities of addiction is that relapse is often part of the recovery process. Many people struggle with multiple relapses before achieving long-term sobriety. Each relapse can feel like a personal failure, leading to increased shame and hopelessness. It's essential to understand that recovery is not a linear journey. Setbacks can happen, but they do not define one's ability to recover. Embracing a mindset that views relapse as a learning opportunity rather than a defeat can foster resilience. Support groups and therapy can be instrumental in helping individuals navigate the complexities of relapse and find their way back to recovery. The environment plays a significant role in addiction and recovery. Triggers in one's surroundings, such as people, places, or situations associated with past substance use, can lead to intense cravings and potential relapse. For example, returning to a neighborhood where one used to buy drugs or being around friends who use substances can reignite the desire to use. This is why creating a supportive environment that promotes sobriety is crucial. It may involve distancing oneself from certain relationships or finding new social circles that prioritize recovery. Establishing a safe space free from triggers, along with engaging in healthy activities and building new routines, can significantly enhance the likelihood of maintaining sobriety. Furthermore, therapy can help individuals develop coping strategies to deal with environmental triggers effectively. In conclusion, addiction is a complex and multifaceted issue that extends beyond the individual. The 8 dark secrets we've explored today, illusions of control, isolation, financial ruin, physical health deterioration, co-occurring disorders, stigma, the reality of relapse, and the impact of environment, highlight the profound challenges faced by those living with addiction. Understanding these aspects can foster empathy and drive change in how we approach addiction in our communities. If you or someone you know is struggling with addiction, remember that help is available. Recovery is possible, and it begins with taking that first brave step. Seeking support from professionals, engaging in support groups, and fostering a positive environment can pave the way for a healthier, happier life. Together, we can break the cycle of addiction.